Democrats had some harsh words for President Trump after his firing of FBI Director James Comey, and some Republicans are raising questions about the move as well. Earlier, I spoke to Republican Senator Bill Cassidy of Louisiana and asked him what he thought of Washington's latest shakeup.
Director Comey is obviously a great American who cares deeply about our country, who's been in a very difficult time. He had become an issue. I think he being the issue was distracting from the mission of the agency. Chuck Schumer called for his firing last fall. Obviously, there's people in the administration who didn't care for some of his actions. Put that together, I think it begins to hurt the mission of the agency. That said, I think he's a great American. Could the administration have handled it better? Absolutely.
Democrats are saying things like they need a special prosecutor. This is like the Saturday Night Massacre. Do you think there's anything to that, or is this just all politics?
I think it's all politics. The fact is he had recently testified before Congress. He had found no evidence of collusion between the campaign and Russian influence. That was the chief thing. There was never going to be a good time to fire, but if you felt like he had become a distraction, he had to be fired sometime. President Trump is clearly a man who makes a decision and makes it quickly. I think we see evidence of that.
But there is an investigation going on now of the Trump campaign's connections to Russia, or at least some of the former advisors' connections to Russia. Is it a bad decision to fire the guy who is in charge of that investigation?
I would argue that he's not in charge. He comes in on Monday morning. He first hears about HR. Then he goes over his budget that he's going to present before Congress. Then he hears about street gangs and drug running, and then he gets a report on this investigation. It is that person heading that investigation who is still there. He is checking in with the director. The new director, if nothing else to show his or her independence, will be just as aggressive as this director.
Do you think they're going to have a hard time finding somebody to replace him?
I would think not. There's been other times when there's been firings as controversial as this, and the person that came afterwards was of a tremendous quality. I would gather it would be the ultimate cap of a career to be the director of the FBI. I think there'll be many who desire to do it.
Do you think this is kind of a flash in the pan, or is this a scandal that's going to go on for a little while? And a flash in the pan. And do you think it's going to affect getting other business done, like health care reform and tax reform?
When it comes to health care reform, events are in the saddle. Premiums are going up. I spoke to a CEO of an insurance company today. They are thinking of premium increases of 30% that they will announce soon. We have to address health care. And so this may be a distraction. It may be important. But the reality, there's some events that continue to press. Health care is one of those.
Well, let's turn to health care then. You are not a typical Republican on health care. Would you agree with that?
I'm not sure.
Well, tell me about
I'm a physician,
yeah.
And so I bring the perspective of knowing the tragedies that family have, how the loss of insurance can make that tragedy worse, or having coverage can help prevent a tragedy. So it is that life perspective that I bring to this issue that may make me different from others.
You have said that everybody should have access to health care. Is that being interpreted differently? Are people interpreting that as though you believe there should be some kind of national health care plan? Or are you just saying the obvious, that we don't want people to be out there in the streets without health care?
First, let's say, when Congress about 20 or something years ago passed the Emergency Medical Treatment and Labor Act, which said that any person, doesn't even have to be an American, can walk into an emergency room and receive all the health care they need for their condition, we have Congress then effectively established a right to health care. That's reality.
The emergency room is the right to health care then?
Totally. As a physician, I worked in a hospital for the uninsured, a county hospital, and as long as those doors were open, we had asthmatics, heart failure patients, liver patients, gastrointestinal bleeding, schizophrenics, drug overdoses, you name it. And they came in and we treated every one of them. Now, that's the reality in every emergency room across this nation. So we can either do that, we can either manage this problem wisely, or we can just write checks. And it's a very expensive proposition to just write checks.
You have a standard called the Kimmel test.
Yeah.
Tell me what the Kimmel test is.
Right now, we've got to lower health insurance premiums. If you speak to middle-class families, their premiums are $20, $30, even almost $40,000. One guy tells me $24,000 for insurance, $13,000 for deductible. I'm out $37,000 before my insurance pays anything. I said, no, you can get your colonoscopy. He did not find that very comforting. So the fact is, we've got to do something about premiums. Now, there's a couple ways to lower them. One way is just to give lousy coverage. That's not good. So that's what we call the Jimmy Kimmel test. If your child is born, and at a moment when you should be celebrating because a life has entered the world, and instead you're pushed away, the doctors and the nurses say this baby may die, we've got to move this baby to get operated on now, and you're thinking, how do I pay? Now, Jimmy Kimmel, he acknowledges he's a millionaire, he could pay it.
Yeah.
But we know that for other families, it's not the case. So that middle-class family paying their premium, they must have an insurance policy that would cover the life of their child when their child was born.
Let's listen to some reaction to this idea of the Kimmel test.
Okay.
Louisiana Senator Bill Cassidy applying a new test.
It's called the Jimmy Kimmel test.
Said it needs to pass the Jimmy Kimmel test.
The Jimmy Kimmel test.
There should be a Jimmy Kimmel test.
It's become the Jimmy Kimmel test.
His passes the Jimmy Kimmel test.
Bill Cassidy's become this national figure with his Jimmy Kimmel test.
And the Kimmel test.
What is the Jimmy Kimmel test?
Since I am Jimmy Kimmel, I would like to make a suggestion as to what the Jimmy Kimmel test should be. I'll keep it simple. The Jimmy Kimmel test, I think, should be no family should be denied medical care, emergency or otherwise, because they can't afford it. Can that be the Jimmy Kimmel test, as simple as that? Is that oversimplifying it?
Hey, man, you're on the right track. And if that's as close as we get, that works great in government.
Do you think you and Jimmy Kimmel could come together and put together a health care plan that could actually become law?
I think if we respect that each person needs to be able to afford their insurance, but have a basic level of coverage, the answer is yes. And I'd like to think that is common ground. I'm frustrated with my Democratic colleagues. They refuse to help. Oh, if you don't invite us in a certain way, if you use certain language, we're not going to help.
You've been very strong on that. You want the Democrats involved in this. This has to be a bipartisan negotiation.
Anything that works for our country long term is bipartisan.
But do the Republicans, does Mitch McConnell want a bipartisan bill coming out of the Senate?
I'm sure he would. It would make his job easier if he had Democrats to collaborate. As the fact that turns out, he does not. I challenge them. If you care about those millions in your state or those thousands in your state who will be affected by some change to the Affordable Care Act, get engaged now so that change is a positive change for the people in your state.
What do you think about the House bill?
The House bill, according to the Congressional Budget Office, would have resulted in premiums rising. So if we take as a main thing we have to do, which is lower premiums, the House bill did not accomplish that. So I think the Senate bill has to take that as a goal. If we achieve that and it passes the Jimmy Kimmel test, I feel pretty good about it.
And one of the main objections to Democrats to the House bill is that they claim that more than 20 million people will lose health insurance.
Yeah, that's part of the rollback of the Medicaid expansion. One thing I point out, by the way, President Trump, when running for office, said 4 things about health care over and over. He wanted all to be covered, caring for those with pre-existing conditions, without mandates. Americans hate the Obamacare mandates,
right, and
lowering premiums. So that's actually a set of values that Democrats and Republicans can get behind.
Right.
And if the president achieves this, I think he's reelected in 3 years, no problem.
Does the House bill even come close to doing that?
The House bill does not. The fact that folks' premiums would rise, and that folks would lose coverage, according to CBO, it doesn't. So I think we need to achieve President Trump's goals, his contract with the voter, if you will.
Is it possible to have a deal? Do you think there will be a deal on this eventually that will be signed by President Trump?
I am an optimist. I think our country, when we get together, can accomplish it. Susan Collins, the Republican from Maine, and I put together a bill called the Cassidy-Collins bill. We think we accomplish this. We give power back to the states, power back to patients. We allow a blue state to do a blue thing, a red state like mine of Louisiana to do something which works for our state. And we do it in a way which I, as a physician, think gives the power to the patient so that she can make the decision best for her family. And we wrote this legislation so that Democrats would be comfortable participating in it. It's my hope that they truly feel comfortable.
But your legislation is dramatically different from what the House passed. And if you send your legislation back there, you saw how hard it was for them to pass this. Do you really think they would agree to your legislation?
I smile because if you think about what the House legislation did, it moved closer to our principles. One of our principles was to give power back to the states to allow them to make decisions, to regulate their own insurance market. That's where the House bill ended up moving towards, and when they moved towards it, it began to break their gridlock. So I think as people become more aware of our principles, aware that these are the principles that can achieve President Trump's contract with the voter, they become more comfortable with it.
If you're right, if your optimism is right, and there is a deal eventually, will it gut Obamacare?
When you say gut Obamacare, there is so much to Obamacare. But if you mean the penalties and mandates that the American people hate, those will be repealed.
Okay. How about the idea of these 20-some million people who will lose their health insurance? Will they lose it?
Under our plan, we allow what is called passive or auto enrollment. When I turn 65, I'll be on Medicare. I can call them up and say I don't want to be, but most likely I'll just be on Medicare. We allow states to auto-enroll those who are eligible. And so you have all these young, healthy folks who really don't bother to sign up. They would receive a credit sufficient for their annual premium, and that credit would get them in the insurance pool. Once you have the young healthies in, then those who are older and sicker have the expense of their illness spread out over the many. And we think that achieves Trump's goals of increasing coverage, but lowering costs, caring for those with pre-existing conditions.
All right. Senator Bill Cassidy of Louisiana, thank you very much, and we really appreciate your being here.
Thank you.